Hey everybody, it's Friday the 13th. I just wanted to come on here and talk a little bit today. I can't come on here and not mention coronavirus. Of course, we're all in the middle of it here in the United States, and if you are living somewhere else in the world, and most places are affected, my thoughts and prayers are, of course, with you and especially our friends in Italy who are really, really struggling right now. So, anyway, but I wanted to just, come on here briefly and talk a little bit about it. Just, you know what to do. You are working. Okay, shoot, I'm sorry, I'm getting text messages. So it looks like it's still working, so that's good. But you can go to the CDC's website, the World Health Organization's website, your local authorities. Of course, they're giving you advice as far as what to do, and I really think that it's important that we of course listen to what the recommendations are. See, I'm touching my face. I'm not supposed to be touching my face, am I? That's one of the things, right? Anyway, as most of you know, I'm a nurse practitioner. I work in a clinic setting, and I certainly could potentially have exposure there, but the real heroes are those that are working in the hospitals right now, and the laboratory workers, the nurses, the doctors, all the staff, any team member in the hospital are really the heroes and on the front lines, and they're the highest at risk, of course, right? And of course, the highest at risk of having bad outcomes, of course, as we know, are the elderly. So while I know the school closures and the inconveniences of being able to only work from home, spring breaks getting canceled, trips getting canceled, it feels really inconvenient and ominous, of course. I think I think we all could benefit from looking at it from a picture of really it's an act of solidarity as a world, as a nation. We're sacrificing our a lot of things so that we can give our healthcare people working in the hospitals and their patients a fighting chance. And so that's really my thoughts on it right now, and I think that most of you would probably agree. So it's really a time to come together. As a nurse practitioner, I really have a passion for disease prevention, and which is why I went to school and why I returned to school to get my doctorate and start Thrive Plant Life. I'm on the local board of a nonprofit here in the Chicago area called the Plant-Based Nutrition Movement. I would love it if all of you guys would find them on Facebook and follow them. They're on Instagram as well as LinkedIn, and we have lots of great content on the website. And it's the biggest impact I feel I have made is really with helping my clients make lifestyle changes that prevent or reverse their chronic disease that maybe they didn't think they were able to reverse before. And I believe that people, when they're empowered to make lifestyle choices, that can have the biggest impact on their life, and empower them through education and coaching and on things like diet, of course, and exercise and stress reduction. People can live a high quality life and be healthier and happier and more active well into their later years. And so this may be a time, where you have to stay in or want to stay in or need to stay in and really can focus on your health. And I'm here to help you. And so that's what I really want to let you know. I have some availability currently for new clients and virtual coaching. It's individualized coaching where we talk about your challenges, your health goals, and meeting those goals. And we have weekly goal setting and some tools and the accountability of one-on-one coaching. We focus on what you want and what you need from a health perspective. And we talk a lot about, of course, it's nutrition coaching, really understanding and even conquering what is best for you to eat on a day-to-day basis, exercise, stress reduction. We cover all those topics, and really what you want and what you need. And it's very, very individualized, and everybody's got different needs, of course. You'll also get a lot of resources, including things like a weekly meal planner, a 21-day menu, and go to plant-based resources that you can go to at your fingertips if you have a computer, and a goal setting worksheet, just to name a few things. We will have weekly virtual one-on-one calls, and so that's really the format and what I have to offer. And I do have a few openings. So if you are interested, please reach out to me. And at any rate, thank you so much for being part of this group. I find it to be so much fun. And I appreciate you all. And certainly stay safe during this difficult time. And thanks for joining.